Warning: please do not use or derive concepts from this video to try answering questions and incorporating it into the steps of a diagnostic approach to a patient. Today we'll be talking about Takotsubo habitus disease from Assassination Classroom. So now we're going to discuss a philosophical conundrum. Is giving a fictional character a fictional disease equate to giving a real person a real disease? I'll let the hippies decide. Now onward to the video. So first we'll talk about Takotsubo dilated cardiomyopathy, which is 100% of the time prevalent with Takotsubo habitus disease. So Takotsubo cardiomyopathy is a temporary heart condition that develops in response to an intense emotional or physical experience. A Takotsubo pot is a Japanese fishing pot used to catch octopus. It is also known as stress cardiomyopathy or broken heart syndrome. In this condition, the heart's main pumping chambers changes shape, affecting the heart's ability to pump blood effectively. It usually heals within 2 to 4 weeks, and most people fully recover within 2 months. You may need a regular follow-up with EKGs, cardiac enzymes, echoes, coronary angiograms to check for your heart's recovery. And the most common findings on EKG is ST segment elevations and T-wave inversions. Other findings are much less common. And you may want to give these patients medications to reduce cardiac stress, such as beta blockers and nitrates, and also recommend the patient to decrease stress factors in their lives. So the type of Takotsubo cardiomyopathy is based on its location. There's the apical type, which is dilation in the apex of the heart. Then there's the midventricular type, the basal type, and the focal type, which most commonly occurs in the anterolateral portion of the heart. So the main mechanism of Takotsubo cardiomyopathy is catecholamine cardiotoxicity. This causes the heart to beat excessively and change in shape over time. And another mechanism is anything that can cause acute coronary syndrome, such as coronary artery spasms or coronary microvasculature impairment. This causes a change in blood flow, which causes a change in heartbeats. So this causes the change in heart shape as well over time. Estrogen deficiency can also cause this disease because estrogen plays an important role in the structural integrity of cardiac muscle cells. So now I'm going to be discussing the patient's appearance. Koro Sensei has the appearance of a yellow bipedal octopus. He is about 3 meters tall and possesses a large bulbous head with a large small beady eyes and a large smile. He uses 2 feelers as arms with 2 fingers each and utilizes the rest of his tentacles to walk with. He wears a black academic dress, a small black square academic cap with a yellow tassel, and a large black tie with a yellow crescent-shaped moon on it. He also has really small nostrils not visible to the naked eye. If there is such a thing as a naked eye, does that mean wearing an eye patch is a dressed eye? So now I'll be talking about his abilities. After undergoing experimentation, Koro Sensei became an octopus-like creature with multiple tentacles. If he were to have one or more of his tentacles destroyed, Koro Sensei can regenerate them. However, this weakens his stamina, but not enough to take him down. Koro Sensei's trademark ability was his superhuman speed to travel up to the speed of Mach 20. He also has superhuman reflexes in addition to his superhuman speed, allowing him to dodge about anything. Koro Sensei can shed his skin and use it as a protective membrane either on himself or another individual, protecting them from even being hurt from military-grade explosives, and can also liquefy himself to fit through small spaces. Koro Sensei can also take advantage of his ability to change color to camouflage with his surroundings. He has shown skill in medical surgery as he was able to heal and revive people from fatal wounds. However, like his regeneration and molting, the surgery also can weaken his stamina. Koro Sensei has cells that fuse with antimatter. His detonation time was exactly 1 year, which is why the Earth was to be destroyed on that date. This moon explosion here was caused by a mouse that had antimatter fused with it. The size of the detonation time and size is directly proportional to the size of the organism that the antimatter was fused with. So now I'm going to talk about some theories I have about Koro Sensei. So one theory is he's made out of lipids and corticosteroids completely. This would imply that he has a fast absorption rate of lipid-soluble drugs and a slow absorption rate of water-soluble drugs. But generally, water-soluble drugs are safe in the general population anyways because they're excreted in the urine. And for Koro Sensei, in order for him to combat the low amount of water traveling in his body, he can create funnels in his body and allow the water to travel to its designated location where it's needed to any vital organs that may need the water at the time. He probably has super lungs because he has excessive amount of corticosteroids. Corticosteroids are important in the development in neonates because they're important components of sphingomyelin and lecithinase. So his lungs are probably really well developed, and he has a higher tidal volume, vital capacity, inspiratory reserve volume, and all the other values as well compared to the average human. And you may want to be careful when giving him fat-soluble drugs such as propofol, which has a severe complication of severe hypotension. That's why usually on standby you'll have corticosteroids and hypertensive medications to counteract the side effects of propofol. And corticosteroids also have an important function in the contractility and relaxation functions of the lung, which is why he can travel at Mach 20 speed. He has a phospholipid bilayer that surrounds him at all times that's being regenerated. And when he is traveling through the air, he's probably going to be inhaling a lot of respiratory particles, which, since he's constantly regenerating, can be expelled from his body. And they're probably not going to cause inflammation in his body because he's made of corticosteroids, which can counteract the inflammation. And since he's constantly regenerating, there's a higher chance that he's going to have cancer develop due to the increased rate of regeneration. So my theory on how his disease process works is he has a de novo mutation that causes the production of nitroglycerin. So my theory is corticosteroids have an anabolic effect on the body, and they can exert their effect on nitrates, which through some unknown mechanism get converted into nitroglycerin, which has explosive properties and can blow up the earth if heavily concentrated into such a tiny area. And there's two mechanisms of how he can combat microorganisms from causing infection in his body. So one is he's constantly regenerating, so the microorganisms get expelled, and another is since his body is composed of such a gelatinous structure, the microorganisms get suspended in the gelatinous structure, and this decreases the motility of spread of the microorganism. And these two theories work together to inhibit the infection from spreading in the body. He probably has a lipid blood cells in his body as well. These probably act like a super HDL and LDL, and then the reason for HDL and LDL to be produced in the body through an evolutionary mechanism is to help repair cholesterol membranes in the body. HDL helps the cholesterol membranes be repaired in the liver, whereas LDL helps with the cholesterol repair in the peripheral tissue. And this can also help with atherosclerosis from developing in his body. Now I'm going to talk about the plan for Koro Sensei. So you don't really need to do imaging because he can just open up his body at will, and then you can perform the surgery if needed. And one type of drugs you may want to give him are chemotherapy agents, which may cause immunosuppression. So which is why you would also give him antifungals, antibiotics, and antivirals and antiparasitics to prevent opportunistic infections. And another thing, we may want to look into researching something that may inhibit nitroglycerin synthesis or glucocorticoid synthesis, but inhibiting glucocorticoids might not be a good idea because he may present with symptoms of primary or secondary adrenal insufficiency. Antihypertensive may be recommended, but he's making nitrates in his body to already contract it, so there may be no point in that. And one side effect of corticosteroids is osteoporosis, but we don't really have to look out for him because his bones are probably highly malleable and can't break anyways. And we may want to recommend a cholesterol high diet just to help and aid him in the regeneration process of the cholesterol membranes throughout his whole body that are constantly being depleted and needing to be refueled. Thank you for watching.